Now, this is a very interesting X-ray, and we'll be seeing few of the things. So in this X-ray, what we can see is there is significant shifting of this mediastinum to the right side. Now, this is the right side that we can very clearly make out, and this is the left side, obviously. This is very well marked on the X-ray film. Now, what actually should be the case that heart shadow need to be around this area. But what actually has happened, that heart is totally shifted to this area. So we can make out that this heart is more often toward this area. And that is all because of the shifting of this mediastinum to this area, and that is because of fibrosis. So whenever we know that shifting of the mediastinum or shifting of the heart towards the opposite side occurs, that is almost always is because of the fibrosis that simply pulls the mediastinal and mediastinal structures towards the same side, or the pleural effusion that usually happens in the opposite side. So as we can see, this is the angle, and this is very crystal clear. This is costophrenic angle, means this is more of a diaphragm shadow, and this is a rib shadow. So this is in short costophrenic angle, and this is completely clear. Clear means there is no any fluid in here. So this is clear means effusion is not there at all. So what we can say is, if we can draw the midline, see, we can draw the midline here. So the midline is more of in this area. So in short, the heart and the mediastinum is completely shifted towards this side. There is no any structure, or there is no effusion or mass on this side. This is more of a empty, or this is more of a normal. And what we can see, okay, this all is shifted structure. So this all is shifted structure. So we can very nicely make out that this is all fibrosed lung. This is all fibrosed lung. That is the reason why the size of the lung is significantly reduced. We can see that on this left side, the lung area is present. We can see lung is from here up to here. We can very nicely make out the shadow of the lung from start to end, but not on the right side. On right side, we can hardly see lung shadow up to this level only. Means this upper lung is completely fibrosed, or more of a in a restricted mode. That is the reason why this fibrosed area will pull the structures of mediastinum as well as trachea to this side. So we can make out this black lining is all trachea. So this is trachea. So this is simply the trachea was supposed to be in the center, but it is on the right side. It means the trachea is pulled toward the right side. We can very nicely make out the air which is present. I'll simply clear the structure so that you can very nicely make out. See, this area, that is, has to be trachea. We can very nicely make out. I'll simply highlight this. So if you can trace this, this is all airway. So this is trachea basically, and that is all shifted toward the right side because of this fibrous lung tissue, which is simply pulling the mediastinum, trachea, and the mediastinal structures toward the right side. Because the fibrosis is there, fibrosis will simply pull up all the structures whichever are present uh, on the contralateral side. The other things which we can see in this fibrosis are, there are two more things which we can really make out very, very clear in this structure. We can very clearly see the dotted infiltration. These are more of a significant lung damage that has occurred over a period of multiple years. So this is more of a irreversibly damaged, fibrosed, and in between you can see calcification in these lesions. Calcification will be bright white, what we call it as hyperdense or more of a radiodense structure. So this whitish nodular things is more of a fibrous lesions over a period of multiple years. The other things which does suggest the fibrosis or restrictive lung disease is the space in between the ribs. So intercostal space is very important. So we can here we can see the space is from here to here. So this is the space. This is basically rib. We can very nicely make out this is the rib and this is the rib. And in between is this space. So this is the space. So whenever there is fibrosis, the space will be diminished. So this is the rib and this is the rib, and in between this is the space. This space is diminished or reduced because of the fibrosis. So what we call it as, this is more of a crowding of the ribs. So whenever there is fibrosis of the lungs, there will be pulling of mediastinum, trachea, lung tissue, heart tissue towards the collapsed or towards the fibrosed lung tissue. You can see the more of a nodularity because of the involvement and more of a fibrosis of the lung tissue. And the other thing is the crowding of the rib spaces. The crowding uh, of the inter-rib space or intercostal space is a very, very, very common feature of the fibrosis of lung or more of a restrictive lung disease over a period of time when it occurs. So in nutshell, this is trachea, which is shifted to the right side. The heart shadow is completely shifted to right side because there is no heart in this area. These are the mediastinal structure which are completely shifted to this side. We can very nicely make out the radio dense structure. We can very nicely make out the typical nodularity or infiltrates of the lungs, what we can call it as a mottling pattern or nodular mottling of this right lung tissues that suggest chronic lung disease that is very commonly associated with restrictive lung disease and which eventually forms the fibrotic lung disease, which eventually leads to pulmonary arterial hypertension. What we have seen is there is reduction in the space of inter-rib space or intercostal space is diminished. What we call it as crowding of the ribs. So this is all about today's talk. Thank you.